contains antibacterial soaps are getting closer scrutiny after Food and Drug Administration officials announced Monday there is no evidence that they are any more effective than plain soap and water. For more on this and what it could mean for products that many people use every day, we're joined by Dr. Ed McBride from Summit Medical Group, and we really appreciate you coming on today to address this. And
my pleasure.
In addition to the concerns about their effectiveness, the FDA is concerned that the active ingredients in these antibacterial products could actually be causing harm. Explain why that is and what's at play here.
I think the preliminary information, starting from some studies that the EPA is doing and working in collaboration with the FDA, they found that there may be some impact on our endocrine system, hormones in the body. And so they want to be more certain of the safety, but also of the efficacy, lacking studies that show the effectiveness. Is it any better than soap and water? And right now, there's no evidence to say that it is, as you noted.
You've been in medicine a long time. Does this surprise you at all?
It does not. It really does not. I think that most of us don't wash our hands as much as we should, and sometimes we look for something quick, something simple. I'm guilty of using the alcohol gels quite frequently, and lacking soap and water, that's the second best option, but really nothing beats soap and water.
And I want to talk more about these hand sanitizing gels. They're not going to be reviewed because they have alcohol-based, is that right, or are alcohol-based?
Correct. In fact, the CDC actually recommends lacking soap and water to use an alcohol-based hand sanitizer such as Purell that has at least 60% alcohol content, to use a lot of it and to let it dry on your hands. And
Which
I
we
know
were just talking about, we both have been guilty of patting our hands dry with a paper towel or a hand towel, and really not intended for that.
Well, it defeats some of the effectiveness. It does.
So you need to put it on your hands and let that dry.
Use plenty of it and let it dry.
So what does this mean for antibacterial manufacturers? I'm sure they're not excited about this news and this new announcement.
I'm sure they're not. I think as consumers become more informed of the safety, of the efficacy, as well as the lack of need, soap and water is sufficient when used. So I think they'll change their purchasing and buying behaviors. Now, were the studies to show that it's not only not efficacious, but it's also unsafe, then I think that manufacturing practices would change at that point in time. But to be clear, that's not the case yet.
Sure. Nothing has been pulled. They're not recommending that at this point, just still doing some research. Well, let's talk about our behavior, because you noted, I mean, they're so convenient. Most of us have these antibacterial products in our purse, in our cars, easy to get to. How do we change our behavior now that we're so accustomed to these products?
Well, it's difficult. I think informing and educating the public like you're doing today as far as what's safe and how do we prevent disease. I mean, your best protection against not getting sick in this day and age, especially in the cold and flu season, is to wash your hands. Wash your hands before you eat. Wash your hands after you go to the restroom. You know, maybe some common sense kind of things. After shaking hands with multiple folks, wash your hands.
Especially if you're on the go after each stop. You're coming in contact with a lot of germs. You say wash your hands. It sounds very basic. We've all been doing it for a while now, but I think most of us kind of rush through the process. What's the rule of thumb, and how long does it really take to get your hands pretty clean?
You know, the CDC recommends that we wet our hands thoroughly. We apply the soap and that we lather for 20 seconds. The rule of thumb they like to use is hum the song Happy Birthday to yourself, and by the time you're done, rinse your hands thoroughly and then dry them with a clean towel or with air.
Okay. Remember that. Next time you're in a restaurant and you're home, just sing Happy Birthday song as you're washing your hands. Well, thank you so much. Really appreciate you coming on to talk about this topic. Happy holidays to you.
My pleasure. Merry Christmas.
Yeah, thank you. I appreciate it. And we're coming right back.